Hello, this is Michael Onus, and today I'm heading out of Lagos, Nigeria for an unscheduled visit to a small town called Ogijo. Ogijo is located about 60 miles outside of Lagos, and today it is my hope to find out what medical facilities are available to the local community there. I hope by highlighting such facility, I'm able to make recommendations and seek fundings through the help of our friends and allies for improvements for better healthcare on a grassroots level. Our first stop is at the Oladayo Clinic, headed by Dr. Olawale and Dr. Samuel. This is a 5-room clinic serving mostly the needs of women and children in the Ogijo community. As you'll soon find out, this facility is in need of the most basics of healthcare equipment and infrastructures. Average income of this community is about $3 on a daily basis, and this clinic is mostly funded through donations of the community, receives no funding or support from the states or the federal government. While we were waiting for the doctor, it was brought to my attention that they were actually busy in surgery helping with a childbirth. Here is Dr. Olawale and Dr. Samuel telling us about their services in this community. So what is your name, sir?
Dr. Olawale Akubi.
Okay.
I'm the medical director of Olada Medical Center.
Olada Clinic. And how long has the clinic been here?
5 years now.
5 years, okay. And on the average, how many patients do you see on a daily basis?
Daily about 10, 15.
10 to 15 patients daily? Okay, and you cover everything from general practitioner to surgery?
Sorry.
What are your specialty? Gynecologist? Okay, all right. As far as your needs are for this clinic, for example, what do you think are your immediate needs?
Equipment to update our practice.
Okay, so we're going to be taking a quick tour of the clinic itself,
yes,
to kind of just see a visual essence of what you need in the clinic.
Most people that we see here are the masses. They are very poor. They sort of come even without deposit before we attend to them.
Okay.
We found the income has been very, very low compared to what it has been. So these are some limitations in terms of trying to keep this place to a standard that befits a modern practice.
So what happens if somebody comes in, they can't afford to pay? What happens? Do you refuse them service or do you serve them anyway?
Then they die. Some will have, even when we close our eyes, by the time they start begging, what can we do?
Mommy, I'm sorry.
This is a case of retail products.
Okay.
Retail placenta. It was brought in from another hospital.
How's she doing?
She's okay. She's greeting you.
Good afternoon.
In fact, we should have given blood. We don't have money for blood.
No transfusion.
They cannot afford to take transfusion. We could have helped us because she did a lot.
Are you able to call local people to donate blood, for example?
So we manage through some drugs.
Okay.
She's just borderline.
Okay, okay.
She's going to go. This is another case. Got in this morning. Was supposed to be operated, though with IUFD. But unfortunately, we had to deliver to the vagina. It was more or less a kind of disruptive operation. Delivery. But it's okay too.
Sorry.
Those two should have gone through CS, but the financial aspect of it. was delivered about 5 6 days ago now.
Okay.
Through cesarean section.
How's the baby?
The baby is fine. She's fine.
Generally,
They have paid only how much now? 34,000. And they are begging to let us go leave them.
so what is an average delivery, natural birth delivery in your clinic cost?
Per month cost. Normal delivery is 15,000.
And what about a CS? Cesarean?
CS average we take 100. But they don't pay.
Of course, of course.
At the end of the day, we are lucky to get out of that problem.
Okay.
We will tell them 100, but at the end of the day, we don't. This was the case of our ovarian cyst, massive ovarian cyst. Very big.
How is she doing?
Yesterday. Yeah, say hello to them.
Hi. Ekaro.
Very big ovarian cyst.
The video there. So good morning. What's your name, sir?
Good morning. My name is Dr. Adeyemi.
Adeyemi.
Samuel.
Okay, Adeyemi Samuel.
Yes.
Nice to meet you. And you work at this clinic.
Yes.
On the average, how many patients do you see on a daily basis?
On the average of daily basis, we see the average of like 20 patients.
20 patients.
Like from 15 to 20 patients in a day.
And you perform surgery. You perform.
We perform some of the general surgery, like angiography, cesarean section, mammectomy, and there are sometimes we even go for laparotomy.
And you do this locally here?
Yes, we do it locally.
Okay. In complicated cases, what do you do? Do you refer the patient to
There
other
are some
places?
of the complicated cases that we do refer to like OSUT. I mean Olabisi or Nobanjo Teaching Hospital. That when we see some of the cases that we cannot handle or that we have even started, we refer them there.
How far is this hospital from you? The nearest major hospital, how far is it?
It's about, let me say from here to Ikorodu.
Okay. What are your immediate needs that you think will improve your clinic right away, right now, if we can get them for you?
For now, we need a lot of things. So the environment we are now, they are not paying. Even if we had them to pay this sum of money, they complain. And it's very difficult for us to maintain this place. Like, you can really be hearing the voice of the generator now. We run the generator for past 9 months now, no light in this side. And we have been on generator. What we need like the sort of light, maybe like big generator or like bells. We also need bells because the site that we are just starting for this clinic is just very near to this place now. I may likely take you to the site soon now. The site is a new site. We need more bells. We need like the X-ray machine. We need the scanning machine. And some other things that be of help, like some of the foreign drugs too, because there are some drugs that they do here that we don't have it, that most of them are being faked. But if you can get some of the foreign drugs that we are very sure of the potency, can be of help for the patient.
Maybe perhaps what will happen is I will ask you to maybe send me a list of drugs that you have. We can find out if the manufacturer who may be willing to donate drugs. You know, the organization like Doctors Without Borders. Yes, so we'll talk. I'll take a look at your new facility. Thank you very much. Okay, when do you think realistically this will be ready?
Well, it depends on how I
Depend on money.
If I have money today, God will not stop.
Okay.
We're just trying to, for the past 2 weeks, we're trying to do the septic tanks on the soak away.
So let me ask you, if you have a complication, life-related cases right now, what is your transportation mode to take them to any other hospital?
Public transport.
Public transport. Okay.
I tried to get a ambulance, but I haven't got an ambulance. But somehow we had to dispose it. It was giving us so much trouble.
Ah, okay.
I have some friends that have ambulances. I call them.
So come and come.